What are the most common reasons patients need non-emergency transportation?
Most of it is due to dialysis needs. They have to get back and forth to dialysis, doctor's appointments, things like that, but they don't need to go to the hospital to get taken care of. So some people take the non-emergency transportation to go get their medicine and get groceries.
What were the biggest problems patients faced when trying to get reliable transportation?
Finding the
That
the companies that they're following to set up the appointment list to actually fill up. We found in our business that we would get to a dialysis center to drop off a patient of ours and have the staff there ask us if we could transport somebody else to a patient back home, back to the nursing home, because they were supposed to be picked up 24 hours. And they were sitting there in their wheelchair in the lobby with all of these people and no dignity. And they're just left there. So finding the people that are going to show up and provide them the care.
Oh, that's awesome. Well, that's fantastic. That makes total sense. Those are some of the things that I've heard in the industry the most is the problems of just finding somebody to come pick me up and it's dependable. How does medical transport differ from standard ride-share services like Uber or Lyft?
Well, most of it, they don't have the So most people that are going to these doctor's appointments and dialysis and things like that or get their wheelchair home, they use a walker, they use a page. So being able to get into a specialized vehicle, like an NEMT vehicle, is something that they need. So where in Uber, if you have a wheelchair, you're not going to be able to get into an Uber without a baby. So having that opportunity to stay in the wheelchair, because in a wheelchair van, you stay in your wheelchair van, you're secured down inside that van, and you're transported up there. So there is no getting out of the wheelchair into another vehicle. And some people can't physically get out of the wheelchair.
Right, that makes sense.
There's no way to be able to even get into some public Uber or Lyft.
Right. Okay. Well, that makes perfect sense. It's amazing that here we are in 2026 and we're having a discussion about, how we can transport people that are in need of mobility or mobility challenged. It's just unbelievable, which is why we've come full circle with SanaRide.
Well, I've been doing this since 1996. And this is still, like you said, 2026 now.
Yeah.
And we're still dealing with the same issues in different states, different areas. It's not a local problem. It is a nationwide problem.
Wow, that's amazing. That's fantastic. What do you think, how often did you see patients miss opportunities due to transportation issues, and what impact did that have? Meaning, how many times did you think that somebody didn't make it to a dialysis appointment or didn't make it to a doctor's appointment? Was that an ongoing issue?
If a patient doesn't get to dialysis, if they miss a dialysis appointment that can last 4 hours, and they don't go but every other day. So if they miss an appointment and they are not being taken care of or taking care of themselves the way that they should be, it can lead to catastrophic difficulties for them. If they can end up in the hospital because, again, if they're not being, their system's not being taken care of and cleaned out correctly, it causes 60,000 different medical issues that they have.
Right.
Patients that don't get to a doctor's appointment, maybe they don't get their meds. Maybe it was a medicine checkup day, and in order to get their refills, they had to be there. So now they're going to be going without their medications until they can reschedule appointments to see the doctors.
Right.
And sometimes those can take weeks for rescheduling.
Absolutely. Yeah.
Those are the difficult
Some of the biggest challenges that these folks have, which is really tragic. What safety standards or protocols are critical when transporting medical patients? There's always a concern today with, wear your seatbelt in the cars. Do those translate in these medical vans?
They do. In the medical vans, you would be able to pull a wheelchair in on a ramp. So the ramp flips them up, we pull them in, and then they are harnessed. There are 4, sometimes 6-point restraints that pull that wheelchair. Once the wheelchair is secured, then the patient is now secured to whatever the back belt they have, and then the shoulder straps that are within the van. There should never be a van out there that doesn't have all of those safety features. And the drivers that are transporting them are qualified to be able to use the current strap that they have on every patient every time.
That's interesting. How important is communication between the driver, patient, and medical facility? Is there a breakdown in communication? Like, from just looking in from the outside, I see that it goes, the simple thing typically goes from the hospital to a broker to the NEMT company, to the NEMT company dispatches. With SanaRide, we're trying to limit that breakdown in communication. Is this something that you feel that an app will be able to help solve those long-term delays as far as communication goes between the hospital and the actual person that's in a wheelchair? Is that, have you seen that that's an issue in the past?
So it's like telephone universal. You have a patient that needs to be transported and you have to call company A. Company A then has to turn around and call company B. Company B tells company C to Dr. C to verify a visit. And then it all comes back around. Well, in that situation, mistakes happen. Times get said wrong. They give you different days because they thought it was Wednesday, the next day the date was Thursday, and they give you the date, not the day. So there's always those type of miscommunications where if you had an app where everybody could go to a one-stop shop, you took all of the information in the app. So that it is dispatched to whatever crew that it is sent to. Now you don't have to.
Right.
So you've eliminated, in some instances, 3, 4, and 5 different people to do one trip.
No, that's amazing. So technology definitely is taking a leap forward in the NEMT industry with our SanaRide app. What are some of the training sessions or training things that you do for these drivers that drive these vans? There's always a concern that somebody may pick your mom up or your dad up that doesn't have the training that they need when they get there for somebody who is mobility challenged.
Well, every wheelchair driver has to be a CPR certified.
Mm-hmm.
They also have background checks done and drug testing and things like that. So the certification that they need is CPR. Then they are trained on how to transfer patients from their beds, from their chair in their nursing home or their home into the wheelchair, and then how to relocate them to the wheelchair, and then how to secure them down.
I see.
The wheelchairs, once they're in, have to be locked in place. And so it's a lot of getting up and down on their knees. So we try to make sure that there are ways that they can be trained that it's not such a stress on them, but to know that they're doing it accurately every single time.
Yeah. That's important because there's always a concern with safety issues, with traveling over the road and whatnot. So that's important.